Greetings everyone. The Group 8 will discuss about the illness that can be avoided using the insect repellents. To ward off mosquitoes, ticks, flies, and other biting insects, people use insect repellents. Mosquito can transmit disease such as malaria, Lyme disease, dengue fever, and etc. Repellents are not meant to kill insects, but to keep them away to prevent bites and the spread of disease. There are 6 illnesses that can be prevented with insect repellents. One of them is malaria. Malaria causes symptoms that typically include fever, tiredness, vomiting, and headaches. In severe cases, it can cause yellow skin, seizures, coma, or death. Symptoms usually begin 10 to 15 days after being bitten by an infected mosquito. Malaria is caused by single-celled microorganism of the Plasmodium group. The disease is most commonly spread by an infected female Anopheles mosquito. The risk of disease can be reduced by preventing mosquito bites through the use of mosquito nets and insect repellents or with mosquito control measures such as spraying insecticides and draining standing water. Several medications are available to prevent malaria in travelers to areas where the disease is common.
Lyme disease, also known as Lyme borreliosis, is an infectious disease caused by the Borrelia bacterium, which is spread by ticks. The most common sign of infection is an expanding red rash known as erythema migrans that appears at the site of the tick bite about a week after it occurred. The rash is typically neither itchy nor painful. Approximately 70 to 80% of infected people develop a rash. Other early symptoms may include fever, headache, and tiredness. If untreated, symptoms may include loss of ability to move one or both sides of the face, joint pains, severe headaches with neck stiffness, or heart palpitations, among others. Months to years later, repeated episodes of joint pain and swelling may occur. Occasionally, people develop shooting pains or tingling in their arms and legs. Despite appropriate treatment, about 10 to 20% of people develop joint pains, memory problems, and tiredness for at least 6 months. Prevention includes effort to prevent tick bites such as by wearing clothing to cover the arm and legs and using tick-based insect repellents. Using pesticides to reduce tick numbers may also be effective. Ticks can be removed using tweezers. If the removed tick was full of blood, a single dose of doxycycline may be used to prevent development of infection, but it is generally recommended since development of infection is rare. If an infection develops, a number of antibiotics are effective, including doxycycline, amoxicillin, and cefuroxime. Standard treatment usually lasts for 2 or 3 weeks. Some people develop a fever and muscle and joint pains from treatment which may last for 1 or 2 days. In those who develop persistent symptoms, long-term antibiotic therapy has not been found to be useful.
Dengue fever, a mosquito-borne tropical disease caused by dengue virus. Symptoms typically begin 3 to 14 days after the infection. These include a high fever, headache, vomiting, muscle and joint pains, and a characteristics of skin rash. Recovery generally takes 2 to 7 days. In a small proportion of cases, the disease develops into severe dengue, also known as dengue hemorrhagic fever, resulting in bleeding, low levels of blood platelets, and blood plasma leakage, or into dengue shock syndrome, where dangerously low blood pressure occurs. Dengue is spread by several species of female mosquitoes of the Aedes genus, principally Aedes aegypti. The virus has 5 stereotypes. Infection with one type usually gives lifelong immunity to that type. but only short-term immunity to others. Use insect repellent. Examples are off lotion and Baygon mosquito and fly killer. Wear long sleeve shirts and long pants and control mosquitoes inside and outside your home. Each year, an estimated 400 million people are infected with dengue virus through the bites of infected mosquitoes. About 100 million get sick. Subsequent infection with different type increases the risk of severe complications. A number of tests are available to confirm the diagnosis, including detecting antibodies to the virus or its RNA.
There are actually three types of plague: the pneumonic plague, septicemic plague, and lastly, bubonic plague. Bubonic plague is one of those three types of plague caused by the plague bacterium or Yersinia pestis. 1 to 7 days after exposure to the bacteria, flu-like symptoms develop. These symptoms include fever, headaches, and vomiting. Swollen and painful lymph nodes occur in the area closest to where the bacteria enter the skin. Bubonic plague is mainly spread by infecting flea from small animals. It may also result from exposure to body fluids from a dead plague-infected animal. Mammals such as rabbits, hares, and some cat species are susceptible to bubonic plague and typically die upon contraction. In the bubonic form of plague, the bacteria enter through the skin through a flea bite and travel via the lymphatic vessels to a lymph node, causing it to swell. Diagnosis is made by finding the bacteria in the blood, sputum, or fluid from lymph nodes. You can also use repellent if you think you could be exposed to rodent flea during activities such as camping, hiking, or working outdoors. Products containing DEET can be applied to the skin as well as clothing, and products containing permethrin can be applied to clothing.
Onchocerciasis, also known as river blindness, is a disease caused by infection with the parasitic worm Onchocerca volvulus. Symptoms include severe itching, bumps under the skin, and blindness. It is the second most common cause of blindness due to infection after trachoma. The parasite worm is spread by the bites of a black fly of the Simulium type. Usually, many bites are required before infection occurs. These flies live near rivers, hence the common name of the disease. Once inside a person, the worms create larvae that make their way out to the skin, where they can infect the next black fly that bites the person. There are a number of ways to make the diagnosis, including placing a biopsy of the skin in normal saline and watching for the larva to come out, looking in the eye for larvae, and looking within the bumps under the skin for adult worms. There are no vaccines or medications available to prevent becoming infected with this disease. The best prevention efforts include personal protection measures against biting insects. This includes wearing insect repellent such as NN-diethyl toluamide DEET on exposed skin, wearing long sleeves and long pants during the day when black flies bite, and wearing permethrin treated clothing. The next and last one is the West Nile fever, an infection by the West Nile virus, which is typically spread by mosquitoes. In about 80% of infections, people have a few or no symptoms. About 20% of people develop a fever, headache, vomiting, or a rash. In less than 1% of people, encephalitis or meningitis occurs, with associated neck stiffness, confusion, or seizures. Recovering may take weeks to months. The risk of death among those in whom the nervous system is affected is about 10%. There is no human vaccine. The best way to reduce the risk of infection is to avoid mosquito bites. Mosquito population may be reduced by eliminating standing pools of water, such as in oiled tires, buckets, gutters, and swimming pools. When mosquitoes cannot be avoided, mosquito repellent, window screens, and mosquito nets reduce the likelihood of being bitten. So there is no specific treatment for the disease, but pain medication may reduce symptoms.